Hey, Dr. Patel, George Jackson, Brookdale Hospice. I want to talk to you about Mr. Carlson if you have a minute. I know our clinical specialist said you didn't think he was appropriate for hospice, and he's got a diagnosis of metastatic lung cancer. Could you tell me a little bit about his prognosis? Mr. Jackson, I think you're quite aware that metastatic lung cancer doesn't end well, and Mr. Carlson's prognosis is not very good. I don't think we're looking at a great outcome, but I don't think hospice is the answer. I'm not ready to accept defeat yet. Well, Dr. Patel, I never really looked at hospice as defeat. I always think it's a continuation of your good work. Do you think Mr. Carlson would be with us come Thanksgiving? Actually, I wouldn't be surprised if Mr. Carlson was, if he was to pass before Labor Day. I think he's really on the decline and not doing well. But I don't really think hospice is the way to go and tell the family that we've lost all hope and he's going to die just yet. I appreciate where you're coming from, Dr. Patel, and I talked to the family and they told me that you've kept him alive for about 4 years now, so it's a great success for you, and I want you to continue that success. You know, we're talking here about Mr. Carlson maybe not being with us at Labor Day. Hospice is a 6-month benefit paid for by Medicare. The family is really anticipating that it's going to help them. Let me explain a little bit about hospice and what it'll do for the Carlsons. The family themselves is going to get education, they're going to get support, they're going to get bereavement support, and Mr. Carlson's going to get great care. We're going to have one of our aides checking on him every day, 5 days a week, and we're going to have a nurse there who's going to be there 2 to 3 days a week. And it's going to be really helpful to keep him in the home, which is his desire. And I really think that the family and the patient have chosen a route in which that they're not giving up. They're just choosing the quality of life that they have and the time that they have left. Would you think that that's appropriate for Mr. Carlson at this point, since you think he is declining? I think he's declining. I understand the family's wishes. If you can help the family, that may be a good thing. Why don't you get back to me in about a month or two, and we can see if we can do something for Mr. Carlson then. Dr. Patel, in all good due respect, is there anything that's going to change his prognosis in a month or two? Is there anything that you're going to do for him that's going to increase his quality of life or his time that he has here versus the family's wishes of enjoying the remaining weeks that he has left here? Because if not, I'd really love for you to give me a script for an eval and treat now, and we can get our nurse started on it. Well, all right, let's give you a script today for an eval and treat, and we'll see how this goes. Thank you, Dr. Patel. I thank you on behalf of the Carlson family. I think it's going to make a world of difference in the quality, comfort, and pain relief that Mr. Carlson has at the end of life. I'm going to be in this area on Tuesday, so let me stop back. I'll let you know how the eval went. I'll let you know how Mr. Carlson and the family are doing, and maybe we can talk about some of your other patients that we can put on service. Well, Tuesday I'll be busy, but if you want to come by, you can let me know about Carlson, but don't push your luck.